Desde el WOC 2016 estamos en los días de las presentaciones de Pancórnia y es un honor presentar al Dr. Larry Hirst. Él es el director, el CEO del Centro de Pterygium en Australia. Dr. Hirst, can you give us the pearls of your talk yesterday at the Pancórnia Ocular Surface talk and at the talk that's about to start today in the second session?
Well, first of all, it's a great pleasure to be here and a great honor to be invited. The basis of my talk is that virtually everyone who undertakes pterygium surgery, their prime concern is how often will a pterygium come back. I have got one step beyond that. I no longer am concerned about recurrence. My concern is to make an eye that's had pterygium surgery as beautiful looking as a normal eye, and that is my goal. So everything I've talked about yesterday and today is directed towards that. Today I will be talking principally about the first time removal of a pterygium. I'll be discussing the history. In fact, it's interesting that the starting point of my procedure is based on something reported many years ago in Bogota, Colombia by Jose Barraquer. But I've taken it a lot further. And today it will be trying to let the audience understand the principles of this particular surgery. And the basis of it is an extensive removal of tenons so that you prevent recurrence, because this is the cause of recurrence. The second basis for this is to create a good-looking eye. You need to do a number of particular things, including a huge conjunctival graft, a particular suturing technique, and removal of the semilunar fold. I have reported on 1,000 such surgeries, and there has been only one recurrence in those surgeries. I am now up to 2,500 surgeries, and in the primary pterygiums, I still only have one recurrence in over 2,000 cases. And so that's the reason I no longer am concerned about whether a pterygium is going to come back. And what is more, over 95% of the patients have an appearance of the eye where you would not be able to tell that they've had surgery. So it now makes it easy for me to extend my indications for pterygium removal, not only to patients who have a lot of discomfort or have visual loss, but also to patients whose principal concern is that they have a very ugly red eye and want a nicer looking eye. As far as the recurrent pterygium is concerned, as I spoke yesterday, the result is not always cosmetically as good as a first-time removal. And it can be, in extreme cases, some of the most difficult surgery that I have ever done. However, if it is approached in the same way as I do a primary pterygium, the results for recurrence are almost as good, not quite as good. So I have now undertaken over 400 recurrent pterygium removals, and in those 400 I have had 2 recurrences, minor recurrences. It teaches us a number of things. The first go at a pterygium is by far your best chance, and so really the right method has to be used from the start. And secondly, and probably controversially, you really don't need to use mitomycin, you don't need to use amniotic membrane, you don't need to use glue, you don't need to use radiotherapy. Some of these treatments have potential blinding side effects, and they are best avoided, particularly mitomycin and radiotherapy. You can do all of this surgery just by using the tissue that is present in the normal eye. Admittedly, it is not simple surgery, and it is lengthy surgery, but for the patient and the surgeon, it is absolutely the best way to go.
Thank you so much, Dr. Hirst, and welcome to Mexico.
Thank you. It's
See you
been a
again.
pleasure to be here.
Thank you.